views expressed are solely those of the speaker and not necessarily those of Paltalk.com, AVM Software, or its advertisers.
News Talk is online. News Talk Online, a production of Paltalk.com, the largest multimedia interactive program on the internet, with more than 4 million unique users on demand on iTunes and on YouTube and on my blog, GaryBaumgarten.com, where you can post your comments, whether you agree with yours truly or not, no retribution. And you can also subscribe to my Twitter feed, twitter.com/GaryBaumgarten. First and foremost, so that you can be an informed citizen of the world and chatter on Paltalk, and secondly, to qualify for a free premium account on Paltalk. And thanks to our good friends at CRN Digital Talk Radio, we're syndicated to an additional 12 million households. I am your host, Gary Baumgarten. Just very quickly before we get into the issue of the day today and our guest, because we will be breaking away before the end of the show to segue into the live coverage of the launch of the Space Shuttle Endeavour. And I won't be able to make this announcement at the end of the show as I otherwise might. You know that I have committed myself to bringing to you the information about what's going on in Iran, so that the glorious and brave freedom fighters in Iran are not forgotten, even though Michael Jackson knocked it off the front page of the newspapers perhaps forever and away from cable television. Even now, in the evening on the cable television networks, it's Michael Jackson all the time ad nauseum. What more can one speculate about that situation that has not already been speculated? I want to point out two things. There is a young lady who is among the missing, one of the many who's among the missing, who happens to share the same surname as the presidential candidate who believes that the election was stolen from him, Mossavi. And it's a terrible, terrible story about what happened to her and how her family is beside themselves trying to find her. The fact that she likely was brutally sexually assaulted by the militia that captured her and her friends before turning her friends free. I want you to read that story if you read nothing else on the blog. And I also want you to read something that's nothing more than a list of the names of the people who have been confirmed, just the ones confirmed, which is only a small fraction of those believed to be dead. Because you know what? You can throw out figures all you want, but when you see the names of the individuals, even though you don't see the face of the person, even though you don't know anything about the life of that person, it makes it a very human story. And look at the ages. They're all in their early 20s with rare exception. Some of them are in their teens, some of them are in their 50s, but the majority of them are in their 20s. Students or accountants or technicians. A guy working in an air conditioning shop. They came and they grabbed and they killed. It's just horrible. Okay, on that optimistic note, President of the United States, Barack Obama, today held a news conference in which he said healthcare reform is essential to stability in the nation. He said reform of the nation's health insurance system is required to head off instability to families, industry, and the government itself. He used a carrot and a stick. He both praised and admonished Congress a little bit to get them moving off the dime, because, you know, everything that he wants done as quickly as possible while he still has the political strength to push things through the Congress. Now, many of us, myself included, are very concerned about the vast numbers of people in the United States who are uninsured or underinsured, the numbers of which are growing because of the financial recession, people losing their jobs or losing benefits on their jobs, and you worry about people in case they get hurt or sick. How are they going to be taken care of? And the president says, well, my health care reform proposal is a great one because if you're already insured through a private insurer, you can continue to be insured through a private insurer. But if you don't have the opportunity to be insured, we'll offer a government program to, he would say, to complement what the private insurers are offering. But the insurance industry would argue in return, no, what he is offering is competition, and the government would have an unfair advantage over the private insurance companies, and the private insurance companies, therefore, might go out of business. And our guest today is one of those guys who represents the insurance industry. His name is Andy Bunn. He is a partner at McCarter English, a New Jersey law firm that represents managed care companies. Andy is a litigator who represents his clients in disputes with hospitals and doctors over reimbursement and in disputes with individual policyholders, as well as in disputes with other health care plans. He says the government plan would be so attractive to employers that they will drop their private insurance coverage, putting those insurance companies in peril because they have a smaller pool of customers. And he says, so what? You may say, well, Andy says, well, not good for you and me because the coverage you're going to get with the government is going to be substandard as compared to the coverage you get with the private health insurers. Andy Bunn, you're swimming upstream on this one because you know what a lot of people are concerned about, exactly what I articulated at the beginning of the show. So I welcome you to News Talk Online on Paltalk.com to tell us what you think and to bring some balance to the story. Welcome to the show.
Thank you, Gary. It's good to be with you.
It's great to have you here.
I think you've captured a lot of it, Gary, with your description there, and I don't think anybody is going to tell you that the current healthcare situation is perfect or that there is no change required. But what we're looking at here are a couple of very vague proposals that change day by day as we approach the deadline that the president has imposed, which is the congressional August recess. And we are seeing and hearing about details sometimes several times a day. But what the current proposals look like, and there are different ones in the House and the Senate, so it's going to be something that has a little bit of each of those, I imagine, is that you're going to impose significant additional costs on the health insurance companies that people currently rely on. It looks like another $100 billion in taxes that they're talking about as of today.